Many a times, medical practitioners will tell you it is very important for you to take care of your body. It is very important for you to take care of your health. Now, there is one very, very sensitive part of the body, one of the organs of the body, which is very sensitive that, if properly not taken care of, might lead to a terrible situation, which might cause a total blindness if care is not taken. This disease is called glaucoma, and this will be our focus for today on the issues on IKD 106.1 FM. A very beautiful time to welcome you to another very educative conversation today on the issues. You know how we do it every Thursdays, which is in partnership with General Hospital Ikorodu, where we have medical practitioners that are well grounded join us here in the studio to talk to us on how best we can take care of our health. It is an honor for us again to have another medical practitioner, a doctor guest with us in the studio this morning, who will be talking to us about what glaucoma is. So, when you hear the word glaucoma, what is the first thing that comes to your mind? Yes, of course, the eyes. Now, when we talk about glaucoma, how dangerous, how bad can glaucoma be? What are the risk factors involved with glaucoma? What are some of the symptoms you should be looking out for? When you see these things, you should know that this is glaucoma knocking at the door. And how best can you prevent glaucoma? All of these and more, plus the treatments to glaucoma, we will be discussing today on the issues. I am Okoyemi Adebambo. I'll be your anchor for today, as well as my doctor guest who is well seated already with us in the studio in person of Dr. Mrs. Dada, who will be putting us through this conversation. Now, do not also forget that you can join us on this conversation by calling the studio lines 0904 081 1061 or 0904 082 1061. If there are questions at all to ask our guest today, you can do well to call us. When we get to that bridge, we would, of course, cross it. Right? Don't forget that today we are talking about glaucoma. It's also very important to note clearly that Glaucoma Week happens to be this week. This began on Monday, and the essence for this Glaucoma Week is to create awareness to the general public. This is a campaign to the general public, helping every individual out there understand that it is key, it is very germane to take care of your eyes, just like it is important to take care of your health. Again, I say good morning and welcome to the issues on IKD 106.1 FM. I go on this very short breather. When I return, I'll turn on the microphone for my guest in person of Dr. Mrs. Dada, who will be taking us through this conversation. Don't go nowhere. We will be right back. Cheers. And don't forget that I told us that today we will be having our focus on this awareness, this campaign that has begun since on Monday, a whole week long, to, share to the world. This is not just a Lagos thing. This is not just a Nigerian thing. This is what is, it's a standard practice. It is something that is done all over the world. And this week specifically has been set aside as the Glaucoma Week. And that is why we are talking about glaucoma today, the causes of glaucoma, the symptoms, the prevention and treatment of glaucoma. On that note, I would want to very much welcome our guest in person of Dr. Mrs. Dada. Good morning and thank you for joining us.
Good morning.
It's good to have you in the studio.
Having me here.
And I must say you're looking very radiant.
Thank you.
So let's get to the conversation this morning. You are a medical practitioner, and looking at your profile, you are a trained medical practitioner. You sure know your onions well when you talk about your field. The week called the Glaucoma Week. I want us to even start from there before we start talking about what glaucoma is all about, what causes glaucoma, the symptoms and all. What is the essence of the so-called, in quote, Glaucoma Week? What is the week all about? What happens during the Glaucoma Week?
Okay, well, Glaucoma Week is a week set aside, in a year to create awareness for glaucoma, because many people don't know about glaucoma, and in creating awareness, we can prevent a lot of people from, sudden blindness, or at least not knowing what happened to them. They just wake up and then they notice that their vision is impaired or is blind, and they'll be thinking, we live in a society where they think of so many things.
A lot of just think it's a spiritual thing, my village people.
Yes, exactly. So in creating awareness about this disease, at least it will bring light to it. And many people, the aim of the campaign is for people to come to the hospital and do eye checkup every year, at least once in a year.
At least once in a year,
because glaucoma, like they said, is the second leading cause of blindness worldwide.
Worldwide.
Yes, the second. The first number one is cataract, but is the one taking the second, position. And many people are not aware of it. So in coming to check, coming for checkup at least once a year. Another thing in quotes that we always say is that it's a silent thief of sight, because it can creep on people and they won't know until the last stage, and by that time they are presenting, the damage has been done. Another keynote is that it's irreversible. There's no cure. And that's
there is no cure.
Yes, there's no cure for glaucoma. What we do is we manage it, we treat it. But we can't totally, reverse whatever damage that has been done. So that's why we have to create this awareness for people to know that they need to come to the hospital at least, if not twice, at least once a year for their eye checkup to screen for glaucoma.
Thank you so very much, Dr. Mrs. Dada, for that opening note. If you're listening, you've heard it directly from a medical practitioner. At least once a year is very much fair for you to get your eyes checked. And you also heard it, just like I have heard, that this happens to be the second leading thief of the sight. It steals the sight, and of course, it destroys the sight. You have also heard it clearly that it cannot be cured. It can only be managed. I was going to ask that question, but thank you that you've done well to put us through that. Having said all of these, right, one of the reasons why you're here seated is to help the world know, to help Lagosians and the good people of Ikorodu here be aware of what glaucoma is all about and the dangers attached to glaucoma. Now my question is this: what is glaucoma?
Well, glaucoma is not just, let me just say, it's not just a single disease, it's a group of diseases.
It's not just a one kind of disease.
No. It's a group of diseases that affects a particular portion of we call it the optic nerve. And what is causing that is the pressure, the buildup of pressure in the eye. Just like we have high blood pressure, in the body, and it causes a lot of damage. When there's a buildup of pressure, there's a fluid. I can't go into much details, but I'll try and explain. There's a fluid in the eye that the eye, how will I put it? The eye makes the fluid and it must regulate. There should be a balance in that fluid. But when there's a buildup of that fluid in the air, it will damage what we call the optic nerve. Why is the optic nerve important? It's the nerve that connects your eye to your brain. It sends electrical signals so that the brain can interpret, what you are seeing. So when that nerve is damaged, it's like cutting the wire or reducing.
So there is no communication.
Yes, there's no communication. And so people start saying that I can't see, or I can see, but the edges, I can't see the edges of,
Start complaining of partial. You're not seeing clearly.
Seeing patchy, eyes, and so many things, so many other symptoms which I'll still go into. But the main aim is the intraocular, that pressure that we're talking about. We call it intraocular pressure. The aim is not for it to get high. Once it gets high, it will damage the optic nerve, and then we have glaucoma.
With what you have said, Dr. Dada, I want to ask, I just need to be sure, and I know people out there listening to would also want to know, when we say glaucoma and how well you have explained it, that is to say that this is not a one-time thing, it's a gradual process. It builds up. I want you to help us understand how it builds up before we go to what causes it.
Well, there are two types. Let me just say there are two types. Majorly two types. There are other types, but the major, the most common two types of glaucoma are the one that we call it open angle. I don't want to go into so many medical terms, but I'll try and simplify.
Yes,
we call it open angle glaucoma. The thing is that there's a drainage pipe, let me put it that way, in the eye that drains the fluid. That it's like a network. It drains the fluid in the eye. But when there's a blockage of that drainage, now the blockage, the one I'm talking about now, is a gradual thing. It's like blocking the drainage, but not totally. It's like it's blocked.
There is no free flow. It is not totally blocked, but there is no free flow.
So the pressure will start to build up, and of course, this is one of the reasons why it will, the pressure will build up to a point that it will damage the optic nerve. The other one is that angle. There's a particular angle, that same angle that we're talking of, the drainage measure. If it narrows, that's when you have if it narrows suddenly.
Okay.
That's when you now have the acute type.
Okay.
You understand? That one is the sudden type that people, they say that my eyes are paining me, my eyes are red. But most times, the gradual one does not give signs.
It doesn't give signs?
Yes, it doesn't give signs. So it's at the latter stage that the vision is actually getting more and more impaired, that the person will say, okay, there's something wrong with my eyes. Let me check. But by that time, remember I said earlier, it's an irreversible damage. Whatever damage has been done to the retina cannot be reversed. So what we do at that point when you are presenting late is just to preserve the little vision or whatever it is that you brought in, so that the vision does not go worse.
Okay, saying so that the vision does not go worse now, I must ask again, when does it get bad? At what point, as a medical practitioner, can you say that, oh, this case has gone bad?
That is it. It doesn't give sign. Most
times,
it doesn't give sign. That's why, that's the whole essence of this campaign. That's why they call it the silent thief.
The silent
thief. It doesn't give signs. There's no sign. Most times, there's no signs. There's no signs. Just the person presents, my vision is growing dim, and by the time you are checking, it's glaucoma.
Is this glaucoma something that you can say is genetic? Is it?
Yes, there are other risk factors. I'm just talking of generally now. There are other risk factors. Like, let's say, glaucoma can happen in any age. I want to put it out there.
Okay.
Even from a little child.
So this is not about when you get to age 40, 50, that's when you start having
it. It can happen at any age. Like what we call congenital. But those that are risk factors now, risk factors, those that are more predisposed to having it, are those that are above age 40, those that, have debilitating disease, maybe diabetes, hypertension, that could also lead to that. People that are nearsighted or farsighted, maybe those that have myopia too, can actually be predisposed to glaucoma. Then above all, the black race, we are all blacks.
The black race. There is always a black race factor.
So we are predisposed to it. It's also a risk factor. Then trauma, sudden trauma could cause it. Then even certain surgeries too. You understand? Then some certain immune disorders and so many other things can cause glaucoma. But the bottom line is it could happen at any age. But of course, the risk factors are also different. Age 40 and above, and all that.
If you're listening to us talking about glaucoma today, you've also heard it that it is genetic. There are tendencies that if a father has it, it is most likely the son or the daughter might, also have. But then, to be very clear now, what are the tendencies of a child having glaucoma if a father or a mother has it? Are the tendencies on the high side or on the low side, or are there ways to measure where one can say, okay, you might or you might not?
That's why it's always good to come for screening. Once a family member has it, it's always better. That's one of the questions we ask when you come to the clinic. Is anybody blind in your family? Maybe father's side or mother's side. We want to know because of the, predisposing factor for the child or a family member having it. So it's always good to come for screening.
It's always good to come for
for
screening.
checkup.
Yeah, we have looked at some of the risk factors, and then we have also talked about the causes now. In as much as you say it doesn't give signs, it doesn't tell you this is a thief, and thieves do not even really tell you they are coming to, boggle you. Then what are there symptoms?
Yes, there are symptoms.
Let's talk about the symptoms.
What the symptoms most likely that patient will present with is redness of the eyes, pain.
Pain?
Yes, it could be severe, it could be mild, moderate, ocular pain. I'm talking of eye pain now. Some come with headache. You understand? Then blurry vision, like I said. Then some will say, I'm seeing rainbows, I'm seeing, halos. What I mean is a ring of light around objects, or I'm seeing different colors, even when there are no colors. And then the one that many people don't notice is that, or some might, is that when they are looking at an object, the edges of the object are blurred. Normally, when you are looking at an object, you should be able to see the periphery of that object. But when you are now seeing it as if it's like you are seeing through a keyhole or something, then that means that there's a problem. So blurry vision is also part of it.
Blurry vision.
Yes, blurry vision.
When you talked about the risk factors, I recall that you were talking about short-sightedness individuals too.
Yes.
And that would, I really want us to talk about that short-sighted, because
well,
this is a category where a lot of people fall
people with myopic, call it myopia, they're also, predisposed to it. It's like we say in medicine, one thing leads to the other. So such people, they need to even come in more frequently to check. I'm not saying they will have glaucoma eventually, all of them will have, but at least it's, how will I put it, it's a very high risk factor. It's, even those that have hypertension, diabetes, and some other, autoimmune disease or whatever, they should come in and check their eyes, because what we are trying to prevent is that intraocular pressure from, increasing and then causing damage to the optic nerve. So anything, and then there's some other factors too that can come in, ischemia. Let me not use those big words. That can cause damage to the optic nerve. People that have sickle cell disease, for instance. And so, that's why it's always good to come in. See, bottom line, the whole thing, SN, is come in for screening.
Come in for screening. During the course of this conversation, we would like to know when best to come in for screening at the General Hospital here in Ikorodu. I am aware that there are times to where each department receive people, times and days. So towards the tail end of this conversation, we would also like for you to tell us when best can people come in. You have said at least once in a year, twice in a year is on the fair side. But moving ahead, before we turn on the phone lines on 0904-081-1061 or 0904-082-1061. If you have questions as regards our focus for today, glaucoma, it's the Glaucoma Week, and this is how it is done to create awareness to the general public that your sight matters a lot, and it's important for you to take care of your sight. Get yourself checked. Very, very importantly. That is very, very important. Now, talking about the symptoms, you have talked about this and all of them. Maybe we should take this first call from this end. If this person... Okay, we lost that call. You can call us back on 0904-081-1061 or 0904-082-1061. Another thing we do on the show to help people understand is we take our time to pick out fallacies or myths, like depending on what the case might be. When we say glaucoma, when we created an awareness as regards this program for today, one of the things that people want to be sure of is that, does our diet have any role to play in glaucoma? Some are of the belief that, maybe depending on what you eat, sometimes it might be the one that will affect it. Is that a true statement, or this is just an assumption of fallacy?
Well, it's an assumption. I'll call it an assumption because generally what we eat affects the whole body. But in this case, it's not really, I won't say it's a direct cause of anything you're going to put into your body that is going to cause glaucoma. But I said we have secondary causes.
Yes.
Somebody that has, let's say hypertension, we are talking of high cholesterol and the rest. I won't advise that person to start eating fatty foods and all that, because eventually hypertension will still go back down, lead to something wrong in the eye, and when we find out, it might be, predisposing towards glaucoma. So it's not.
Maybe we should take this call. Sorry, Dr. Dada. Hello to you. Good morning. Oh yes, yeah. Good morning. Thank you for calling. Good morning, Mrs. Shunaya. Good morning. How are you doing this morning? Please go ahead if there are any questions for my guest.
Does it have to do with what you are eating?
She's greeting.
Good morning. Thanks for calling in. Well, I won't say it has to do with anything we are eating, but the bottom line is that you should be on a balanced diet. Someone that has diabetes, that is predisposed to that is predisposed to glaucoma. Somebody that has hypertension, that is predisposed to glaucoma, should be on a very balanced diet. But diet generally has nothing to do with
glaucoma. Let's take this other call before we go straight ahead. Hello to you. Hello, you're on. Good morning. Hello? Okay, I'm not sure he's ready. When you're ready, call us back. You have heard that, Mrs. Shunaya, the diet has no role to play when you talk about glaucoma. And we're still talking about the risk factors. We're looking at the symptoms. And now this will bring me down to how best it can be prevented. Because the essence of the whole campaign, the gospel we're trying to propagate is that don't even get close to glaucoma.
Yes.
Be aware of this thing. So how best, can we prevent glaucoma? How best can we avoid and stay clear of glaucoma?
Well, the best way to prevent glaucoma is to come in for screening once a year.
Once a year?
Yes, then of course you should avoid anything that would traumatize the eyes. What I mean by that is when maybe people are fighting or, exchanging blows, you stay clear. All those things too.
For punch, go and touch your eye.
Yes. Those are the ones we can, handle. But you can't do anything about your race, which is the black race. You can't do anything about your age if you're above 40 or, there are some other things you can't do anything about. But the ones we can do something about, then there's some good, like they said, diet. Some foods are actually, good for the eyes. We call them all these carotenoid kind of food, like carrots, anything that has orange or yellow, they are very good for the eyes. But apart from that, the mainstay is still to do what? To screen.
Now let's talk about drugs now, majorly unprescribed drugs.
Sorry,
let's talk about that
too. I forgot about that.
Yes,
then you mentioning drugs. People should not use drugs arbitrarily. Steroids is one of the risk factors. Steroids, in our culture, some people want to be big, they start using steroids. They call it in Yoruba mau, that kind of thing. They just buy drugs over the counter and they use. That could predispose to glaucoma. So we don't advocate the use of unprescribed drugs. Yes, so that's one of the
talking about unprescribed drugs, there are still other categories of people that. Now, these people I want to talk about, I don't know if you know, but you should know them. These are people that will decide by themselves to just wear some sort of glasses that are supposed to be, in quotes, recommended. But they do not go through the right channel of visiting a medical practitioner to get their eyes checked and tell them this particular. For you, do you think this is also a risk factor to glaucoma, or people could just decide to go to the market and just buy whichever glasses and wear?
It's not okay, or let me say it's not wise to just go to all these people selling glasses. I'm not talking of sunshades now. Maybe some people they have light photosensitivity, but even people that have light photosensitivity, it's one of the symptoms of glaucoma, the early symptoms. So it's better the cause of why you have that light photosensitivity and coming to the hospital for a checkup. But I don't recommend going to the roadside and getting glasses. If you have a need for glasses, the best is to come into the hospital. We find the reason why you need that glasses, and then we recommend that glasses for you, because it could be a bigger problem. It might just be a tip of the iceberg showing you a symptom or a sign of something bigger. But if you come in and it's just glasses you need, we have professionals, they call them optometrists, that will do that for you. And you get the best result from that.
Having talked about the preventive measures, talking about the symptoms and other factors that are in line with glaucoma, I think it would be nice for us to talk about how it can be treated, because there are two persons involved in these, those that are supposed to prevent glaucoma from happening and those that are already currently battling with glaucoma. How is glaucoma treated? Put us through the process to which, because some people will just have glaucoma and then decide to wallow in their pains and just say, I can't even go through that treatment, it's expensive, it's this and all of that. Put us through
there's drugs to be used, eye drops, and there are also surgeries available. All the aim of this modality is just to reduce the intraocular pressure and to reduce further damage to the optic nerve. Most times we use eye drops, which there are different categories of eye drops. You have the prostaglandin inhibitors. I don't want to start mentioning all those big words, but the aim is to reduce the pressure. So there's actually a way we can preserve vision as long as possible. But the thing about it is that people don't know that when they start these drugs, these glaucoma drugs, they can't stop.
It's continuous.
It's continuous.
You don't stop using them.
Yes, and that's where we have problems with most of our patients. We prescribe drugs, but then they use it 1 or 2 months. They say they are tired and they go off drugs. But
sorry to interject you there. Let's take this other call before we go ahead. Hello to you. Hello to you. Good morning this morning. Oh yes, please go ahead.
Okay. Yes, you just mentioned surgery now.
Yes.
Okay. How is it to be taken? Is it after the something has affected or what? Or when it has go to the last stage?
Okay. Stay with your radio. She would attend to your question. Thank you, ma, Mrs. Shonari. Thank you very much. Yes, please go
Okay,
ahead.
those that they will recommend surgery for is the the how will I put the type of glaucoma,
Mm.
the stage it's in, that the doctor will know which of the surgeries that will best suit
Mm.
the patient. And apart from that, like I said, even the aim of the surgery is still the aim of the drugs. Is that to either reduce the fluid production
Mm.
or to reduce the pressure or to reduce further damage to the optic nerve. So there are different types of surgery. We have the trabeculectomy
Mm.
and so many of them like that can be recommended. But like I said, the mainstay
Mm-hmm.
is to make sure that it doesn't get so bad.
When we talk about the treatment now, one thing that you said that I want to hold on to is the fact that when drugs are prescribed, you don't stop using your drugs. You continue using your drugs until the last day.
Yes, but you have to come in. Sometimes we reduce the drugs, sometimes we add some, we reduce some, depending on the pressure. You understand? Depending on the pressure. And then we also check. There are different tests that you have to do to even establish that, okay, this person has glaucoma. You have the fundoscopy, OCT test, CVF, so many tests that you have to. There's a barrage of equipments and stuff that you need to make a good diagnosis of.
Looking at how you have said it, I want to think the way some people would think now, listening to you on radio. Some persons might just feel, what is the point of going for treatment? What is the point of buying the drugs when there is glaucoma? Why don't I just wait till the dying day? Pardon me to use that word. So why should we treat glaucoma when it cannot be cured?
Because glaucoma will eventually lead to blindness.
It could lead to blindness.
Yes, if it's not cured. And once a patient is blind, we can't reverse that. We can't reverse it. So that's why glaucoma is irreversible. Damage to the eye is irreversible, and because of that, whatever we can do to stop that process from progressing, that is what we will do.
You talked about surgery, Dr. Dada, where you said it could get to a point of surgery, not just medications and all. And if I'm not mistaken, there are some other parts of the body that when damaged, you could replace. It happens with the leg, the hand, and some other parts of the body. Now, curiosity wants to make me ask, if the eyes are damaged due to glaucoma situation, can the eyes be replaced? Because mentioning surgery is sounding like I said, it's not possible.
Unfortunately, no.
The eyes cannot be replaced.
It can't be replaced.
Okay, you mean in Nigeria?
No, I mean worldwide.
All over the world.
All over the world.
The eyes cannot be replaced.
Can't be replaced, and that's why this advocacy is really important. You can't replace it. Maybe some certain parts, maybe the cornea transplant, but I've not seen optic nerve transplant. At least till this morning.
I know of kidney transplant. So a father cannot decide that I want to give my eyes to my son.
I've not seen optic nerve transplant. That's why they were talking about. I've not seen it.
Oh.
Like, I'm going to transplant it. Maybe tomorrow morning when I wake up, somebody might have found that out.
Because I'm looking at one of a situation where a father will say, I'm old already. I want to give my eyes to my son.
No.
Okay. Now let us look at the way it works with your hospital currently where you are, General Hospital Ikorodu. You have said people can come down at least once in a year to get their eyes checked. Put us through the process. What is it like, to get checked? What is it like with General Hospital Ikorodu? What are the requirements? What are the things needed? People run from hospitals. One of the major reasons is because they fear that it's expensive to go to the hospital. How affordable is it to get your eyes checked?
Well, General Hospital Ikorodu, I think Lagos State in general is one of the cheapest, places you can go to Not just cheapest, you get the high quality, treatment there.
The whole of Lagos can hear what you're saying.
Yes, the whole of Lagos. I'm talking of general hospitals in Lagos State, especially General Hospital Ikorodu is one of the best.
It's cheap and affordable.
Yes,
with the best equipment.
Best equipment and best personnel. What I mean by
that. A caller wants to talk to you. Let's take this call. Hello to you. Good morning.
Yeah, good morning.
Yes, good morning, Mr. Isa Mustafa.
Thank you, sir.
Talk to us.
First, madam,
This.
I'm a victim of food malnutrition problem.
Okay, sir.
That caused a lot of height problem for me since 95. And I use a lot of drugs. And the condition remain unchanged. According to when research report I got, they say food malnutrition problem, height problem, is untreatable. I use a lot of drugs, I use everything. So this event since 1995, I'm unable to read any book. Imagine, and I use everything I can do, but there is no solution to that kind of problem as a result of the food malnutrition effect. So I want to encourage, I want you to advise me. I've used all the recommended plans from the smallest to the last gauge. It's not working.
Okay.
I don't see anything. So I want you to advise me what next.
Sorry about your condition.
All right, Mr. Mustafa, please stay with your radio. She will attend to your question. Thank you very much for calling. So let's attend to Mr. Mustafa.
Sorry to hear about your condition, Mr. Mustafa. But
or maybe we should take 2 more calls so that you just combine. Yes. Okay. Hello to you. Who's there?
Hello, good morning.
Yes, good morning. Thank you for calling us this morning.
Yes, I'm Mr. Yusuf.
Mr. Yusuf, calling from where?
I'm calling from Ojoko LCDA, Ifakojayi, under Ifakojayi, local government.
Ifakojayi. Thank you for calling us. Any questions?
Yeah, welcome. I want to appreciate the consultant, the resource person you brought in today.
Thank you.
For this important topic. But I haven't heard a lot eulogy on Ikorodu or General Hospital in general. Let's be sincere with ourselves. I know the government is doing their best. The health practitioners are doing their best. But I wish the government on their side should try as much as possible to get us more ophthalmologists. I know people are getting out of the country. We are short of, and because the queue at these general hospitals. I'm not particular about that
Ikorodu General Hospital
in Lagos State here. The queue and the scanty of the professionals, the ophthalmologists. So imagine you. This is what I experienced. Imagine you being given an appointment like let's assume you are queuing. You're having like 100 patients. A ratio of an ophthalmologist attending to all of them in a day. It's not easy. The ophthalmologist will not even do the work right. So I think I know people is not the fault of the government too. But we need more ophthalmology. If it is to go and hire them the way they hire footballers, we can do it. We do hire footballers. We pay them. Let them go to Cotonou. Let them go to African countries and bring ophthalmologists. Go there yourself, Mr. My presenter, and check what is going on at that on their appointment day. Go to Ifako Hospital, go to all the general hospitals. You will testify to what I'm saying. I'm a victim of it, so I pray we improve. May God be with us.
Thank you so very much. Yes, thank you for your contribution. Thank you so very much for that one. Okay, we have 2 callers that has called in. I want us to take it up first from Mr. Isa Mustafa, who gave his health conditions with his eyes.
Okay. First of all, sorry, Mr. Mustafa, to hear about your health, your eye condition. Like I've been, saying all along on this program, glaucoma is irreversible. Whatever damage has been done has been done. The aim of those drugs, probably that the ophthalmologist gave you, is to, slow down the progression of the disease. It cannot reverse the vision to its former, the way you were saying before the condition, took over. So what the aim of those drugs is just to slow down the progression of the disease so that it does not lead to eventual blindness. But they cannot reverse, the vision to its former way it was, seen before. Then
that is for Mr. Isa Mustafa. So if you're hearing us, Mr. Isa Mustafa, the reason why it looks like you're still managing that situation is simply because it can only be managed. It cannot be cured. So it is something you now have to live with. It becomes a part and parcel of you. Apologies for that. Now, the other caller also talked about, I know definitely that is not your place, but then what do you think as regards what he has said? Do you want to agree to that or you want to be defensive?
Well, I'll not be defensive, but I'll tell you what some of the things the government has, put in place. Like, for instance, in our own place, they've introduced, I know there's a long waiting time before because, you have to bring out cards from the records, searching for cards. But, since the introduction of the EMR, as the electronic medical records, things have been more faster. And then there are some other equipments we had to bring in, Before there was like the tonometer we used to use was the one that you had to wait, contact between you and the patient. But the government brought in other types that you just have to stay in front of the machine, and the thing is,
almost immediately.
Yes, almost immediately. So I think things can still get better, with more funding, and I'm sure the government is also partnering with some, other bodies to bring in things. I think the future is looking good. It's not as bad as
at least
as it was before. Yes, there's improvement.
Right. To that caller who made that observation, well noted. And there was a part where he said that I, the presenter, can go to these places for myself to see these general hospitals. And on this note, I want to steal the time. Right, this is not within the scope of our profession as a media person. I want to categorically say that General Hospital Ikorodu has been doing well. That I can tell you for a fact. Not once, not twice have I been there without any information, and I have tried to see the affairs of things there. This is to that caller, and I see that there are developments. I will take out this time again to say well done to the medical director. That is my uncle, a friend of the house, Prince, talking about Dr. Taiwo. Right? Yes, he's doing well. He's doing well. You would want to agree that his administration has brought about a lot of development and change with the General Hospital Ikorodu here. So let's talk about how it works now. Okay, Mr. Mustafa still wants to talk to you. Hello to you, Mr. Mustafa.
Yeah, I need to come back because of the analysis Madam made to me. You see, that is the area whereby we need to call our authorities to order. You know what happened to me before I lost my year in the last 30 years? I drank Gary for 3 months because of the government program. Are you getting my point? Between November 95 and February 7, it looks like eyes are unable to read anything because I need to. I 84 years woman can see something in 150 feet to my room. I remain at 59 years. I'm not going to see something that is more than 20 feet. To me, to my room. I'm trying to say that we should need to call the government to order full malnutrition with destroy our eye system, memory system, as well as body growth system, people reproductive system. So therefore, it's a weapon of mass destruction. We need to condemn inefficiency, condemn this kind of nonsense. Many of our youth, please less than 15 years. I'm losing access due to this kind of similar hunger program. So that's why I'm trying to control our people. You cannot use science to control this one. Whatever necessary. If it is anything cost my life, ready to sacrifice it. Because I know it's dangerous consequences to 250 million Nigerian population. God bless Nigeria.
Thank you very much, Mr. Isa Mustafa. God bless Nigeria. I like the fact that you ended your note on that. The part I want us to talk about from all that he has said, he's talking about the government. We are not in place to, we can only always tell our government to do better, right? Yes. We cannot compel them by any means whatsoever, which his points are well noted. That is his observation. Let us talk about the age factor thing, which is this area that attracts me so much. Now, he said something that is very germane. Why do we have an 85-year-old woman who can still see clearly, looking at our forefathers then, they do not even use the glasses, and then you see a very young boy who is 12 or 15. You go to primary schools today and you see these young boys and girls using glasses, especially the ones with the rope. What happened? What changed?
Sometimes when we say that there's a prevalence of something in an area, that they might actually have been there, but without proper statistics, you might not know that it's there. He referencing that might not actually be true.
Okay.
Because there was no, let me not say, there was no scientific, study. Let's say no statistics.
There were no clear records.
Yes, no clear records.
So these are the numbers of persons, unlike now.
Yes,
where advancement is set.
Where there's awareness, the people carrying out researches, carrying out updates and all that. They might just be there, but nobody has ever taken the time.
There are no major focus.
Yes.
The little ones that they even see, they say is spiritual.
Yes, do you understand? So I wouldn't totally agree with what he said, because there was no statistics backing his claim. But now we have statistics, we have peer group review, we have different scientific tools to say, okay, there's a prevalence of this in a particular age group or in a particular environment. That's why they could say black race, because some people did those studies
to discover that the black race suffers more.
Some people did the studies of age groups to know that it's more prevalent when people are getting to 40 years and above. People did those research.
Talking about research, Dr. Dada, now you want me to place you on the hot seat, like you said when we started, right? Talking about statistics.
Okay.
With the statistics, how bad is glaucoma? Is this something that is very common, looking at statistics, or is something that, you can say is minute there? A lot of people don't suffer glaucoma.
In fact, it is common. That's why they call it the second leading cause of blindness. Do you understand? It's common because some people, like I said, they did that research before they come to that conclusion. Do you understand? So
in Ikorodu here, let's take our community as a case study now. You are one of the best hands with General Hospital Ikorodu. Are there cases of people managing glaucoma at this time, or you don't really have customers, so to say? You have customers
of people managing glaucoma
in our community here.
In this Ikorodu here. Some just come in, like I said, for screening. We catch a lot of them when they come in for one thing or the other. Some come in with they don't want to go to roadside to collect their glasses. They come in that they can't see well,
and they need glasses.
And then we go the whole 9 yards of checking their eyes properly. We do all the everything, and then we discover that this person has a suspicious disc. When we say suspicious disc, is that we are not saying this person has outright glaucoma without going through the further test, but at least something to say this disc is not looking the way. When I say disc, I mean the optic head now. It's not looking the way it should. So we screen those ones and we go for further evaluation of them. Some we say let's keep checking. Some we place some medication. Some we give just glasses. So many things.
So in most cases, Dr. Dada, that is to say that some people did not even come to be checked for glaucoma.
No, they didn't come.
They came for something different.
Yes, it's an accidental finding that we do, because we did a thorough examination of
which verified what you said earlier, that there are no signs. People might not even know. You might be living with glaucoma and you don't know.
They don't know.
Wow, that is serious. Now let's talk about what we were actually talking about before we had the calls in. A lot of persons have heard your voice this morning, and there might be a repentant souls that wants to visit the hospital, but then they are not sure of how it works. Put us through the details of how it works with General Hospital.
When you come into General Hospital Ikorodu, you ask at the desk. We have a front desk.
Okay.
We call them ask me. We have shirts.
Yes, I see that shirt.
You ask them that you're going to the eye clinic.
Eye clinic.
Yes, eye clinic. We have an eye clinic, a whole floor dedicated to the eye in General Hospital Ikorodu. So when you walk in, you go to the records.
Okay.
They will register you. We use EMR now, so they will give you an electronic card.
Okay.
Which you use to register, and from there you proceed to the nursing station, and then you do some vitals. Like I said, hypertension is one of the problems. And
so people living with hypertension and diabetes has tendencies.
Yes.
Wow.
Yes. So we do the blood pressure there. We do the random blood sugar. before we even say, okay, yeah, come, we take it to the optometrist to read. We want to see how far, or the visual acuity, what you can read from afar. You understand? Then from there, you see the ophthalmologist. So that's the way it goes. And we work from Monday to Friday.
Mondays through Fridays.
8 a.m. to 4 p.m.
You any of these days, Monday through Friday, where you say you come in, you see the Ask Me attendants and all of that, and then they forward you down to the eye clinic.
Yes.
Right? Does it have to be an appointment? Do you have to have an appointment?
No, you can walk into the eye clinic.
Okay.
It now depends on what you came for. We will evaluate you first to know how far or how how we are going to see you. But at least you come in first. We evaluate
and get checked.
Yes, get checked that day.
That is the first step.
Yeah, that's the first step.
You might be out there listening to us and you're looking at a paper right in front of you or an item, object right in front of you, and you feel you're fine. You might not be. This is not a threat. Your eyes might need urgent attention. No need to panic. General Hospital Ikorodu is always there for you every Mondays through Fridays, where you will be directed to the eye clinic where every necessary check will be done. It's important you get your eyes checked. I will be doing mine before this week runs out. I would.
I'll hold you to that promise.
I will be doing mine this week. So I would also want to know where I start. This is more like as if I want to collect my JAM or WAEC result. But then before we leave, I want to say thank you so very much for joining us. 1 hour is like 1 minute with you. You have done so well to enlighten us today on the show. Glaucoma Week has begun since on Monday. It will be ending anytime soon. Tomorrow is Friday and you are gradually wrapping up. What will be your parting words, right? Your advice to every listener out there, Lagosians listening to you at this time. Put all your words together in a basket and dish it to us.
To detect glaucoma early. To prevent vision loss. That's all.
Detect
glaucoma early to prevent vision loss.
I would like for you to write that down if you're at home listening to us. I would like you to take it again so that people at home would understand that statement.
It's best to detect glaucoma early to prevent vision loss.
It's best to detect glaucoma early to prevent vision loss. Thank you so very much, Dr. Dada, for joining us in the studio. It's been nice having you here, and we hope we would have you again some other time here in the studio. I hope when we call, the call still. Let's see if we can take in just one more call.
Okay.
Let's squeeze in this one. Hello to you.
Good morning. This is Friday.
Hey, Mr. Friday.
Good morning.
Mr. Friday, I have intentions of giving you an award. You are always calling towards the tail end. It's good to hear your voice again. It's been a while. I can understand when you say call card. Call card now is expensive in Nigeria. Talk to us.
I don't know. I forgot what you call the name of those things that come out from the eye.
The muco.
Discharge.
The discharge.
Yeah, it's discharge from the eye.
Yes.
What is the thing that causes it that within 1 hour you see another one in your eye, another 1 hour you see another one. So what can be the cause of that thing?
All right. Thank you, Mr. Friday. She will attend to your question. Stay with your radio. Thank you. He's talking about the discharge of the eyes every hour. It keeps coming. What is the cause of that?
Mr. Friday, thank you for the question. It's not normal for discharge to be coming out of the eyes every hour. So it's best you come in. It can be a form of infection, but we also have to
be sure.
Yes, be sure that is it, and it's not something else. So it's better you come in. We have a look at it.
Mr. Friday, tomorrow is Friday. It's a good time for you to go to General Hospital, Mr. Friday. When you get to General Hospital, Mr. Friday, tomorrow Friday,
ask for eye clinic.
Ask for eye clinic or ask for Mrs. Dada. Hold her when you see her. Hello to you. We still have to take it. Hello. Okay.
I forgot to ask this one as well.
Okay.
It says when you eat onion enough, it cleans the eye. How true is that?
Okay. Okay. I think that's another myth that I was supposed to ask you. I forgot. Some will tell you that eat onions very well, your eye will be sharp.
Like I said, a balanced diet is the best. I mean, something, how will I put it? A good thing that becomes abuse can also turn bad. You can't say that because onions is good. Everything you have to do. No. No. So it's just best to follow a balanced diet.
Yeah, thank you so very much. I know there is a lady like that will always, if she's cooking, half of the onions is going to her mouth, and if you ask her why, so that my eyes will be. Thank you so very much. It's been nice having you in the studio. Until tomorrow, same time, same station. The issues continues on IKD 106.1 FM. I am Okoyemi Adebambo, and of course, our host today happens to be Dr. Mrs. Dada from General Hospital Ikorodu. Thank you so very much for the enlightenment. Thank you for helping us understand how important it is to visit the hospital. God bless Nigeria. God bless Lagos. God bless Ikorodu. Your health is important. Stay focused.